the country has faced fears of the triple-demic, COVID, RSV, and the flu. And now parents need to be aware of a rare but severe infection. Just hours now from Christmas Eve, the CDC is warning Americans of a rare but invasive type of Strep A. 2 children in Colorado have already passed away from the bacterial infection.
Fevers, chills, muscle aches, new rashes that might be warm or tender to touch, painful joints. Some kids can even have altered mental status, or they can appear more sleepy than usual.
This comes as families need to be cautious of multiple viral illnesses.
It's not just a COVID problem. We're dealing with COVID, the flu, RSV, but also other respiratory issues that we get normally at this time of the year.
All of those illnesses leading to empty shelves in some places, with certain pharmacies now putting a cap on how many medications you can purchase at one time. The White House weighing in. They say they're making a national strategic stockpile of Tamiflu, the antiviral prescription drug available to states that are low.
Being able to unlock that stockpile and provide states with access to these medications is especially important as we're dealing with one of the worst flu seasons in memory.
So the good news is there are no official nationwide shortages of medications, but there are reports of empty shelves in places, and that is why the White House is unlocking that stockpile.
Okay, Zareen, before you go, we know there are still lots of parents out there going to the pharmacy, struggling to find the right kinds of medications on store shelves. What tips can we give the folks?
Yeah, it is a struggle right now for a lot of parents. So medical experts say generic brands or store brands are just as good as those name brands, and they have the same key ingredients. Now, the other tip is do not give your child an adult version of a medication or aspirin without checking with their doctors. And also, you don't have to hoard. One bottle of a medication should be enough until it's restocked. Joel?